The COVID emergency is over, but the pandemic itself is not. New variants are developing all the time. But as so many people across the globe have some form of immunity, life has mostly got back to normal. But it is important that monitoring continues, especially as we seem to be in the midst of a pretty severe wave of COVID right now. Let's get an update from Dr. Maria van Kerkhove. She is the COVID-19 technical lead at the World Health Organization. Doctor, thank you so much for your time. I wonder if you could give us an indication of how many infections there are globally at the moment from the latest COVID waves.
So, as you've said, the emergency of COVID is over, but COVID is still with us. The threat is still there. I cannot give you a number of people who are infected right now with COVID because we don't have good surveillance around the world and good reporting around the world to be able to provide that answer. What I can tell you is that COVID, SARS-CoV-2, the virus that causes COVID-19, is circulating in every country. We are seeing increases in reporting for the countries that are continuing to report in a number of places around the world. But what is more worrying and what we are really focused on are not the infections and reinfections, although those are critically important. The number of people who are in hospital, the number of people who are requiring advanced care, such as in an intensive care unit, and the people who are dying. And right now we are seeing at least several million infections around the world or reinfections, but we are estimating that there are hundreds of thousands in hospital right now for COVID-19. But I can't give a definitive answer on this because we don't have the surveillance around the world.
Yeah, and in fact, that's so true because we do have immunity. For most people, I would imagine, despite new variants, it's essentially going to be dealt with like a flu. We get a bit sick, we get over it, we move on. Is it the same as flu nowadays, though?
It's not the same as flu. And remember, flu also kills. We do have population-level immunity to COVID-19 because of past infection, reinfection, and most importantly, because of vaccination. But vaccination boosting, additional doses for people, particularly who are among the high-risk groups, those who are of older age, those who are immunocompromised, have underlying conditions, pregnant women, these are people who need to be boosted regularly within 6 to 12 months because immunity wanes over time. So the impact of COVID-19 is certainly different, but COVID-19 and all of the variants that are in circulation can cause the full spectrum of disease, everything from asymptomatic infection to severe disease and death. What we are really focusing on is managing COVID better. We can do much more to make sure people are tested early, that they get into that clinical care pathway, that they receive the therapeutics that they need so they prevent severe disease. And we're just not doing enough. We have not optimized our response to COVID. But as you pointed out, COVID needs to be dealt with in the context of everything else, in the context of flu, in the context of RSV, in the context of other circulating infectious pathogens, as well as floods and droughts and war. But we have to do better because too many people are falling sick. Too many people are needing hospitalizations, too many people are dying, and too many people are suffering from post-COVID-19 condition.
Let's talk about, what the absolute marker is ultimately is, you've mentioned hospitalizations are ticking up, but it's when deaths start ticking up. And I think we all remember those extremely grim days through the pandemic where there'd be the daily death counts. We've moved past that, and I think we all just want to forget it. It was so utterly awful. Talk to me about the death rates, though, because that is such an absolute indicator of whether new variants are escaping our immunity and whether hospitals are going to get overwhelmed. So where are we regarding deaths? Is it higher, for example, than your typical flus at the moment?
I think one thing I just want to highlight is how well you just articulated the challenges that we face right now. We have all lived through something incredibly traumatic, and we want to put this behind us. And I understand that. We understand that here at the World Health Organization. What we are saying is to individuals to be protected, to know what your risk is, and do what you can to protect yourself and your loved ones. But we are also saying to governments, you cannot drop the ball. Surveillance needs to remain very strong to monitor these variants that are constantly emerging, to understand their impact as we go forward. If we look at hospitalizations, I don't have good data in all of the regions around the world. We are seeing increases in hospitalizations in Europe and in the Americas, but that's really where we have good data. We need better visibility on this because a bed that is filled with individuals who are suffering from COVID-19 are beds that can't be used for other diseases. And for far too long, people did not receive the care that they needed because we were dealing with the crisis of COVID. So COVID still causes hospitalizations in people of all ages, mainly among people who have underlying conditions, people who have not been boosted in the last 6 to 12 months. This is what remains critical. And in every country, we need boosting levels, additional doses to be focused on those who are most at risk. There are some studies that estimate mortality compared from flu to COVID-19, suggesting that mortality to COVID is even higher than it is for flu. But remember, flu still kills a large number of individuals around the world. So saying it's just like the flu is minimizing both COVID and influenza. And we could do more for both to protect people who are most at risk.
Yeah, exactly. And the flu jab is something that we always say. Of course, flu is more seasonal, but we always say flu season's coming, get your flu jab. And the COVID jab,
Right.
I think that sometimes people just forget that it is equally, if not more important. Just finally, talk to us about these current variants. Is there anything happening in terms of how the disease plays out with these new variants to suggest that there's something more serious at play, that we could get even sicker, for example?
So this is one of the things that we're looking at. When any new variant emerges, we look at transmissibility, we look at severity, and we look at, do our countermeasures work? Do diagnostics still work, at therapeutics and vaccines? So we have 3 variants of interest that we're tracking right now. 2 of these are XBB sublineages, and those are decreasing around the world in terms of reporting. EG.5 is a variant of interest that is increasing. Right now, it's around 40% of the sequences globally that are detected and shared with platforms like GISAID. The challenge is that in the context of declining sequencing, surveillance, we have declining sequencing. And it's not just about numbers. It's not more. It's about having intelligent sequencing around the world to track these. There's a lot in the news right now about the variant under monitoring of BA.2.86. This is remaining a variant under monitoring. Right now, it's been detected in 16 countries, but we have about 130 sequences globally of this particular variant. We know it's circulating, but it isn't outcompeting the other variants that are out there. And in terms of severity, the Omicron sublineages and the VOI's variants of interest and the variants under monitoring, that's our terminology that we use, we see a similar level of severity. We don't see a change in the disease profile. We don't see an increase in severity or a decrease in severity. And that's one of the key things that we're looking for. We expect variants to be more transmissible because they have to outcompete other variants. But what our worry is that we will see a variant that will become more severe. And that's what we just have to be prepared for.
Yeah, absolutely. And of course, you made the point earlier about the importance of vaccines, but also the importance of early diagnosis, because we now have drugs that can treat this. I have to ask you a final question about the origin of COVID, because of course, initially we were told, it was probably from a market in China, possibly a pangolin or bats. And it was absolutely refuted that it could have come from a lab. Now we're not so sure. I wanted to ask you where we are on the origins of COVID, and whether this virus has done anything in terms of someone like yourself who makes a living from monitoring virus. Has it done anything different to any other virus that we have seen for centuries?
So we don't have an answer to how this pandemic began yet. This is active work of WHO, and particularly of our Scientific Advisory Group for the Study of Novel Origins of Novel Pathogens, or SAGO, and we are pursuing every scientific, diplomatic avenue that we can to better understand this. So there are many hypotheses that are suggesting that there was a spillover event from an animal or an intermediate host. We know that the market played a significant role in amplification, but what we don't know is the source of that virus to that market. There is also questions about whether there was a breach in biosafety or biosecurity with labs that were working with these viruses. And we don't have complete cooperation from colleagues in China to be able to articulate this even further. So the short answer is we don't know yet. I am hopeful that we will still have more information that will become available that can evaluate this. But this is active pursuit by WHO, active engagement with scientists around the world to better understand this. We've never had a pandemic with a coronavirus before, but at the World Health Organization, and people like me and people who work in my field, we're always preparing for that next disease X. What will be the next one that will cause an outbreak and hopefully not cause a pandemic, but has the potential to cause a pandemic? COVID-19 was disease X. SARS-CoV-2 was pathogen X. And many of us in this space were preparing for something like this because we were looking at MERS coronavirus. We had the experience of SARS coronavirus back in 2002, 2003. We're always concerned about influenza and a new subtype of influenza. So we study these types of pathogens, and we're always concerned about respiratory pathogens. Many of these emerging pathogens are zoonotic, which means they transmit between animals and humans. So there are many aspects to better preventing spillover or preventing emergence of these pathogens into the human population. So surveillance is critical. Working with our animal colleagues and across the quadripartite, working to make sure we have good biosafety and biosecurity in laboratories around the world. It's a constant fight that we have. And pandemic preparedness, fight against the virus, but pandemic preparedness is a constant. People like me, people who work in my field, we don't have days off to say, okay, we'll put this aside and think about it for the next one. We are constantly working and looking to prevent spillover. The more we can prevent that from happening, the more we can prevent breaches in biosafety, biosecurity, the better off we are in terms of mitigating the occurrence of outbreaks, epidemics, and pandemics.
Absolutely. Thank you so much for speaking to us. And I think the message is we simply cannot afford to be complacent, whether it's about the monitoring that you do and your concerns that you've raised about not enough monitoring being done, or even with our own infections, thinking, oh, it's probably the latest COVID, it doesn't matter. It might matter. So make sure you get tested, make sure you get your vaccinations. Thank you so much, Dr. Maria van Kerkhove, who is the COVID-19 technical lead at the World Health Organization.